Cancer is already a challenging diagnosis, but many patients are dealt a second blow even as they heal. It's called chemo brain, and it can cause a variety of cognitive issues. To discuss the effects and the possible cause for this issue, we are joined by Doctors Jennifer Munson and Monet Roberts. Ladies, welcome to the show. Great to have you.
Thank you.
You know, I just heard about this term recently, and I'm sure our viewers are saying, I've never heard about this before. What is chemo brain?
So chemo brain is typically experienced by patients who have undergone chemotherapy. And usually when they undergo these symptoms, either during treatment or even long after they've had treatment, they can have issues with memory, such as trying to find their words or learning or finding things or organization. And it's typically something that causes decline in sort of how they're functioning in terms of neurologically.
So how many people are affected by this condition?
Typically, they have said that it's around about 75% during treatment, and then up to 35% after treatment. And those numbers may actually be underestimated because oftentimes it can be dismissed, if you will, in terms of other things that may be going on and may not actually be attributed directly to the therapy.
Yeah, I'm thinking, okay, so if somebody, you know, I'm thinking like older people, or maybe, is this happening to younger people as well, or are you seeing it across the board?
Yeah, so it does happen to younger people as well. It is more common amongst older people and in women as well. But, you know, anyone can kind of suffer from this, even very young people who are dealing with chemotherapy.
Yeah. Okay. All right. So I understand that your research found that the cause of these cognitive effects might be chemotherapy drugs affecting something called the meningeal.
Perfect.
Did I say that right?
Yes.
Meningeal lymphatic system.
Yes.
What
yes.
is that?
Yeah, so the lymphatic system might be a little bit more familiar,
I've heard
right?
that.
So so that's what's draining fluid out of your body. And
Okay.
you know, already we know things with cancer patients, they suffer from issues with something called lymphedema, where you get, you know, less drainage of the tissue and such.
Is that why they're swelling? I
The
understand
swelling,
that
exactly. Yeah, so they get
complained about
swelling, and so there's a number of ways to potentially try to treat that. So your brain also has a lymphatic system, and actually this system was rediscovered only about 10 years ago. And so they kind of line the brain and they drain fluid from your brain. And so that system can get backed up the same way other lymphatic systems can get backed up. And that's been seen across a number of kind of brain disorders. And so here for the first time, we're kind of connecting this system to the effects of chemotherapy.
Yeah. Now, will the drainage help with this chemo brain? Is that what you're finding, or?
So we don't know that yet.
Okay.
But that we believe so. Yeah. In other diseases that I've studied in my lab, and in Alzheimer's disease, we do see that if you can kind of engage that drainage system better, then you can reverse some symptoms.
Yeah.
So, you know, we're hopeful that that could help in chemo brain as well.
Right. So I understand women can be affected by this more than men. Do we know why and what's happening there?
Yeah, so we don't fully know why. I think we have some ideas. A lot surrounds, these lymphatics can be very sensitive to hormones. And we do know that postmenopausal women also can be more sensitive to some of these changes, and many of them, you know, have hormone therapy and things like that. So that's one potential cause, but there's a whole host of things ranging from how women, you know, deal with stress and deal with different things, and just, you know, how they are biologically. So we don't know exactly, but there's some hints there, and that's true across some other diseases as well in the brain.
Yeah. So tell me a little bit about your research and how this might affect, you know, future treatments for cancer patients.
So through our research, one thing that we want to note is that chemotherapy has extended the life of patients, which is phenomenal.
Right. Yeah.
What our research is finding is that potentially that it may also be affecting the quality of life of patients, so they may not be having the best quality of life. And so we hope that our research will open up doors for us to be able to find mechanisms as well as clinical interventions to hopefully supplement chemotherapy to make sure that patients have an optimal quality of life.
Yeah, absolutely. So what's next? What's the next stage here? This is exciting stuff. I mean, you guys are really, you know, getting to the cutting edge of what's happening to their patients, right?
Yeah, so we each run our own research groups, so we'll probably have to speak a little separately on that. So on my end, we are focused on the treatment side. Like I mentioned, we have some treatments that have shown some promise in other diseases, so maybe those could help here. So that's really what we're trying to do now is start applying those and also just better understand how the chemo is affecting these vessels.
Yeah, absolutely.
Also, what's important about our research as well is that we've developed models to now test these kind of disorders. And so now we'll be able to actually advance those models to be able to maybe even go in a direction of patient-specific intervention and drug testing. And so there's a lot of exciting research, I think, that will be coming in the future. That we're really excited about.
Yeah, this is exciting, and I'm excited that you're here telling us about this research that's happening right here in our backyards. You're going to be speaking tomorrow, right?
I am, yes.
Okay, so we're going to hear more about your research and your findings, right?
Yeah, so at the Maury Strauss Distinguished Public Lecture.
Yes, that's wonderful. Okay, so that's happening tomorrow at 5:30 at the Fralin Biomedical Research Institute. That's on Riverside Circle here in Roanoke. And of course, we have a link over on our website at wdbj7.com if you'd like to come and hear her speak. Thank you so much, ladies, for being here.